Hi, I'm Jillian. I am the owner of Body Labs Yoga and Education, and I am on a mission to build more confident yoga teachers and movement professionals through anatomical insights, all right? So today we're gonna talk about the neck, all right? So I've pulled Stan off of his stand back here, and we're just going to look at this part of him, okay? So what I want you to understand is that the neck has 7 vertebrae to begin with, okay? And we call them the cervical vertebrae. So we have cervical vertebrae through the neck, we have thoracic through the torso, we have lumbar through the low back. But we're only going to talk about the cervical, all right? So we have cervical vertebrae 1, 2, 3, 4, 5, 6, and 7. This is the final one, all right? Now, what you're going to understand is that the head is going to rest directly on top of cervical vertebrae number 1 right here. So if I turn Stan around, maybe you can see that a little bit better, that it is going to connect right in there. And you can actually see right in here, you can see this joint where the skull rests on top of that vertebrae. Now this joint right here is where we get the movement that has us doing the yes nod, okay? So as the head kind of rocks here, Stan's not very good at it because he's got a rod up his spine, but if he didn't have that rod, then that movement is going to come from that specific joint. Now, as that movement gets larger, it starts to move into the other vertebrae, but most of that movement comes from this tiny little joint right here, and then there's going to be a matching one over on the other side. Now, if I were to, hypothetically, lift Stan's head right off, take a look at the bottom of his skull, okay? So we've got the front of his skull, the back of his skull, and if I flip it over and we look at the bottom, you see this hole right here? This is called the foramen magnum. Foramen in Latin just means hole or opening, all right? And that foramen magnum, and magnum means large, all right, is where the spinal cord goes up into the skull and connects into the brain. So right here, we have that opening, all right? Now there's other little openings. If you can see, there's kind of smaller ones in around here. That's where the cranial nerves are going to come out of the brain and go directly down into the body, all right, or into the head or what have you, okay? So just know that not all of the nerves come out through the foramen magnum. Some of them come through smaller holes, all right? Now I'm just gonna set this over to the side. We're gonna return back over here to the vertebrae. So now I have the head removed off, okay? This obviously in a healthy human is not going to have any rods in the spine. Sometimes we do have spines that are placed kind of on either, or rods kind of placed on either side of the spine here to support the spine, okay? But that's in fairly extreme situations of pathologies in the spine, all right? Now, what we're going to look at here though, is if you look at the front, I want you to take a look at these 2 vertebrae right here. So we've got cervical vertebrae number 1 and cervical vertebrae number 2, and you can tell that they're a little bit different, all right? And they look different from the other 5 cervical vertebrae as well. So if we look at cervical vertebrae number 1 at the top here, it's a little bit broader, okay? And that's in order to support the skull directly on top of it. But it also, do you see this little nubbin right here? That's actually part of cervical vertebrae number 2. So cervical vertebrae number 1, I want you to think of it like a donut, and then cervical vertebrae number 2 has this kind of nubbin that comes up and protrudes upwards, okay? So these 2 vertebrae actually have their own nicknames. We've got the atlas and the axis, okay? So cervical vertebrae number 1 is nicknamed the atlas, and cervical vertebrae number 2 is called the axis, okay? And so cervical vertebrae number 1 is going to rotate on that protrusion that comes up through it, and that's what gives us rotation. Now, I'm not able to rotate this because Stan is held together by rods and rivets and wires and all of that stuff. And so you can see that there's wires right here that restrict that movement. But in our own bodies, we are able to turn our heads. And most of that movement comes from this location. In order to support functional movement, we need to connect to this area, and that's what our movement practice is going to be all about today.